but the most studied model is cognitive behavioral therapy. Here, mental health professionals would look at how a patient's emotions, thoughts, perceptions, even behaviors are feeding into their symptoms. They would look to challenge, modify, restructure some of these thoughts to help reduce the severity of the pain. Cronky in 2007 reviewed 34 randomized controlled trials and found CBT to be the most effective when compared to antidepressants, nurse case management, PCP consultations, and other forms of therapy. And then Somatoform in 2007 reviewed 421 RCTs, so that's a lot, and found CBT to be the most effective in improving the physical and social functioning, reducing somatoform symptoms and psychological distress. This was when compared to antidepressants, psychodynamic therapy, family therapy, consultation letters, multiple other forms of therapy. Also, assertiveness training can be really helpful. This is teaching healthy communication skills to help the patients better express their feelings, communicate their needs, to reduce any need for the pain, to rely on the secondary gains that they receive from it, such as in the case of Pam, her headaches seem to flare up whenever there's a fight with her husband or when he suggests moving. And then he backs off from talking about moving. And so that's kind of a secondary gain for her in experiencing those severe headaches. And then Meyer and Weaver do recommend this for somatoform patients. Zenick and Lynn in 2007 found assertiveness training to be effective for when somatoform disorder patients suffer from stress or tension in their interpersonal relationships. Family therapy, again, is just really helpful in treating the whole system and really garnering the support of the family to support the patient without encouraging the pain or disease talk, and also in pushing them to be more physically active, socially active, and stay engaged in therapy. Couples therapy has not been studied very closely with somatoform disorder in particular. Welsh and Denton in 2005, however, theorized that somatoform symptoms may be an attempt at avoiding conflict in relationships. Symptoms make the partner of the patient put some space there, avoid the conflict, and then that can actually exacerbate the symptom when the patient feels their partner pulling away. They believe that improving the bond and communication should improve the symptoms of somatoform disorder. Meyer and Weaver also recommend this for patients who have somatoform disorder and struggle in their interpersonal relationships with their spouse or partner. Biofeedback is an interesting one. So that's a computer-related operant conditioning technique used for the assessment and therapy of many psychophysiological disorders. Generally, they use it for a lot of stress-related disorders. There was a study in 2003 that found that patients who were given biofeedback treatment in comparison to a control group who only received relaxation techniques demonstrated a greater reduction in catastrophizing somatic sensations and a higher acceptance of psychosocial causal attributors. Medication. Meyer and Weaver report that duloxetine was found effective in treating the pain associated with depression, and also effective for somatoform. And Halroyd in 2007 reports tricyclic antidepressant medications are found to provide relief in pain, particularly headaches. And then just a couple techniques on the bottom are mentioned by Meyer and Weaver. The first one, confronting the lack of the physiological basis for pain and approaching the rewards or the secondary gains. They recommend this, but we would want to approach that very gently so that you aren't insinuating that there is no real pain. So you'd want to build a strong relationship before you really confront that. Also, contracting with clients to increase the activity may avert attention and energy from pain, and that's a common pain management technique that's used that can be helpful in this as well with somatoform. Okay, so the comprehensive treatment plan for PAM that our team decided on, CBT, it's the most studied, found to be the most effective. So we would definitely use this with Pam to really evaluate how her thoughts, how she's perceiving the world, her emotions, how this is playing into the severity of her pain and the onset frequency. Medication management, we would also make a referral to the psychiatrist to see if he or she believed that a medication would be helpful in managing her pain or reducing her symptoms, alleviating her symptoms. Physical activity, Meyer and Weaver say that rest is always counterproductive, so we would want to encourage this, in addition to social activity. And then assertiveness and social skills training, we really think that this is kind of a critical piece for Pam because she grew up in a house where her parents didn't express their feelings, they didn't communicate their needs, and her mother received her needs through her symptoms and through her pain. And so it doesn't appear that Pam ever really learned how to effectively communicate her needs to her family, to her husband, or how to express her feelings. So we think this could really help her. And again, reducing the need for the secondary gains of the pain. And then couples therapy, her husband has some similar traits as she does. He's non-confrontational, he's kind of unattached, they don't have a very emotionally close relationship. And so couples therapy could really be used to improve their bond, improve their communication, help her get her needs met through verbal skills and verbal expression instead of through her pain. And then again, family therapy to really support her, to have the whole system wrap around her and support. And now Allie and I will do a role play on explaining the treatment intervention to Pam. And I am Pam.
And I'm the therapist.
Hi Pam, good to see you again.
Good to see you too.
Hey, so today I wanted to go over some available treatment options to help reduce the pain you're feeling and answer any questions you have. Does that sound okay?
Yeah.
Okay.
Good.
So you remember how last time I told you how our team is very confident by looking at your symptoms, functioning, and history of the diagnosis of pain disorder. And the good thing about knowing the diagnosis now is that there's available treatment and that can hopefully help you. And we want to make sure to really personalize the treatment to your symptoms and also make sure you're comfortable with everything. So how does that sound so far?
Yeah, I'd like to hear more.
Okay. So CBT is called Cognitive Behavioral Therapy. That's one of the treatment methods we'll be using. And with CBT, it focuses on how your thoughts affect your feelings and then your behaviors. So for example, if you're kind of having some negative thoughts, you could then feel maybe stressed or depressed, which could then make you isolate or maybe increase your pain. So, and all of this together, again, can affect the pain you're feeling kind of on a daily basis. Also, we'd like to do both assertiveness training, and this is going to help you express your thoughts more clearly and communicate just more assertively with your husband, with your children, and any other social interactions. This in turn will hopefully reduce your stress, and again, that should affect the pain you feel. And also, if you're comfortable, we'd love to bring in your husband and children into future sessions. This way, you can practice these skills while you have me there as support, and it can just be, a nice practice environment where you can all learn together. So how does this all sound so far?
I've been dealing with this for so long, so I'm really looking forward to and hope that anything can really help. So
good. Well, our team's really confident this is going to help you, and my role is going to be as a support system for you as you're learning to reshape these thoughts and learning these new skills. So we'll collaboratively work together and hope to reduce your symptoms.
All right, and now Allie is going to go over outcomes.
Thank you. Okay, so as we mentioned before, all of Pam's treatment is going to take place within the pain clinic, and we want to make sure to both support and motivate her through this process. So we want to, which we've already done, we want to provide psychoeducation. We think that will help with motivation because if Pam's confused about her diagnosis or about treatment, that's not going to help with hopefulness for the future regarding treatment. We also want to validate the pain she's feeling because a lot of people with pain disorder are told, oh, there's nothing wrong with you, stop complaining. So obviously we don't want to say any comments like that, and we want to let her know that we're aware she is feeling pain.